Lunch with the League series. I'm Ann Havlick and I serve as co-president for the League of San Luis Obispo County with Cindy Marie Absey. What? Homelessness. How can we alleviate the crisis is the fifth in our 5-part expert panel discussions about homelessness in San Luis Obispo County. Homelessness has been a priority issue for our local league and recently for education and advocacy for the League of Women Voters of California. Our prior programs can be viewed through our links on our website, YouTube, and Facebook, as this one will be recorded and available for viewing at a later date. Homelessness is a complex and critical issue for our community, and we have been focusing on education of this topic to try to understand and learn about the challenges for understanding and addressing the problem and advocating for change. Today's panelists are Carolyn Berg, who is the lead analyst working on both regional homeless actions and a regional infrastructure and affordable housing strategic planning effort for the County of San Luis Obispo. She has worked with the county since 2006, and she is a licensed civil engineer and a graduate from Cal Poly State University in San Luis Obispo. Devin Drake is the director of the County Social Services Department, including its homeless services function. He is a licensed marriage and family therapist for 22 years, including as a child welfare social worker, deputy director for adult and children's services, and he volunteers at various capacity helping youth and young adults. He's married with 3 adult children and 3 grandchildren. Susan Funk, elected to the Atascadero City Council in 2018 and became chair of the Homeless Services Oversight Council in 2021. She lives in Atascadero with her husband and with her son, who attended local schools and is now a college graduate living out of state. On a personal note, she noted that she can cook a tasty casserole for 25 people and regularly does so as a volunteer for the ECHO Atascadero dinner program. And then we have Jana Nichols. Jana has been a panelist for us before on this topic, and she is just fabulous. She's executive director of the 5 Cities Homeless Coalition and has a long history of service to our community, most recently being recognized as a Woman of Distinction in 2017 by Cuesta College and the Women's Legacy Fund for her efforts for the progress of women. She assumed this position as 5 Cities Homeless Coalition's first executive director in 2012 and has spent the previous years as a consultant to the coalition. Her work in the 5 Cities Homeless Coalition, she has spearheaded the development of several key initiatives and collaborative partnerships to address the needs of our county's most vulnerable populations. She currently serves as the county's Homeless Services Oversight Council, as secretary to Supportive Housing Consortium, and was the founding member of the San Luis Obispo County Housing Trust Fund. As at the coalition, Nichols joins a dedicated board, staff, and volunteers in their efforts to strengthen our community by mobilizing resources, support, and hope for the homeless and those facing homelessness. And lastly, but definitely not least, is Dawn Ortiz-Legg, who will act as our moderator for our Q&A. She has lived in San Luis Obispo, California for 28 years. She earned a Bachelor of Arts from Pepperdine University and a Master at International Public Policy from Johns Hopkins School of Advanced International Studies. She is best known in the community for implementing California's renewable energy policies to positively impact and improve people's lives. In 2018, Supervisor Adam Hill appointed Ortiz-Legg as the 3rd District Planning Commissioner to make land use decisions on water, agriculture, energy, and transportation. In November 2020, Ortiz-Legg was appointed by Governor Gavin Newsom to District 3 supervisorial seat, which was vacated by the late Adam Hill. Her priorities in this seat are economic development, the decommissioning of Diablo Canyon Nuclear Power Plant, housing and homelessness, and childcare availability. So without that, I would love to get on to our topic. We're going to start with Caroline Berg, who will be doing a presentation that she gave to the Board of Supervisors on homelessness and strategic planning. Thank you, Caroline.
Thank you, Anne, and thank you to our League of Women Voters Leadership. We really appreciate having this opportunity to come and speak to everyone today. Just going to get my PowerPoint pulled up. Okay, so I'm Caroline Berg. I work with the County Administrative Office, as Anne just talked about. For some of you on this call today, this might be a refresher if you were sitting in on the May 4th County Board of Supervisors update on homelessness efforts. But for the rest, we wanted to make sure that we start off with this overall look at some of the key work that's happened since 2009 and a little bit of background. And then I can walk through some of the future initiatives we're looking at doing. And then I'll be handing it off to our excellent moderator and panelists to really dig into some of the details of how we're addressing homelessness. I'm fairly new to the world of homelessness just this year. And what I can share with you is I've been learning a lot from our organizations and county staff is, I can see that our region has accomplished a lot. I think through the dedicated leadership at local agencies and organizations, the guidance from our Homeless Services Oversight Council, and just the significant collaboration and effort of each individual organization and volunteer group throughout the area, we've really been able to lift up a lot of support services and programs. I think when I look at the progress that's been made and hear stories of how it came about, I think it's really been possible because of continual action, a sustained focus by our leadership throughout the region, and then also coming up with ongoing funding sources to make sure we can maintain our efforts to address homelessness. But as we look ahead, certainly we know that there's more to do. And when we look at the scope of the challenge ahead of us, I think we all understand that we can't possibly do this alone. And so that's a big focus of this year is how can all the various partners and communities really come together to make the biggest impact. And that's going to take deep partnerships across all of those agencies, but also community members like those of you on this call today. So like I said, I do want to look back really quick just to give some context. One thing I wanted to start off is, where's homelessness in the eyes of leadership throughout the area? So the county board, city councils, and many organizations, as well as our state and federal governments, have highlighted homelessness as a key priority this year. So we're seeing more funding being put towards efforts to address homelessness, and we're also just seeing really more sustained focus on how we can work on lifting up solutions here. What that's done in the past, and hopefully with our even greater focus on it now, we can continue this trend. But as we look back in time at the last 4 point-in-time counts, what we can see is that each year we're conducting this a point-in-time count is basically when we look at one 24-hour period in January, how many homeless individuals, both sheltered and unsheltered, were there in San Luis Obispo County, and what kind of information can we learn about them as they're being surveyed. And when we look at that, we can see that homelessness has been reduced, at least as that larger trend. And so that's an important thing as we look at moving forward. How do we continue that trend of reducing homelessness in our region and hopefully preventing more people from entering into it. So this is just to show you some of those trends. I wanted to dig one step further. So this looks probably a little crazy, but that's that same information from the point in time count every other year that's being conducted, but it's broken down further into 1 degree further of detail. So these are subpopulations we're looking at. At the bottom, you can see color coding. And why I wanted to point this out is when we talk about homelessness, a lot of times it's talked about as if it's one monolith population, but it's really not. When you get down to it and you talk to individuals or families that are unhoused, there's a lot more detail of what might have led to them becoming homeless or particular situations they might be in. And so when we start digging into more and more detail like this, looking at subpopulations, we can start to tailor the resources being created or offered to best suit that person's needs. So for example, here with chronically homeless, I'll talk in a moment about a program that was started here locally that was focused really on those individuals who have remained unhoused for over a year and really can end up taking more intensive need for support services. So programs are created specifically to help that subpopulation, and those have helped reduce, as you're seeing in the orange at the bottom here. But really the point here is that among our unhoused residents and community members, we can dig further and further into details, and it's important to do so that we can really try to meet someone where they are and help provide them the best resources. And then who provides those resources? So that's a really complicated question with a complicated answer. There's a lot of different organizations involved in helping our unhoused population. So the county in broad strokes is helping to provide safety net resources. So we're responsible for providing social services and behavioral health services, which includes mental health and substance use treatment countywide for all eligible residents. And that often includes unhoused residents. And then we have our cities that aren't responsible for those same safety net programs, but they're helping to plan for and develop affordable housing, and also implement a number of initiatives and programs like safe parking. And then we have community-based organizations. So this includes nonprofits and developers and others that are often receiving grant funding and compiling private donations and government funding to try to lift up and create critical facilities like our shelters or support services where they're out doing street outreach and other really important work efforts that are connecting unhoused residents into services or housing that they really need. And then all of those partners are coming together to really lift up a lot of different initiatives, like I mentioned, whether it's mental health treatment or getting access to food or supplemental income, health services, shelter and housing, veteran support, legal assistance, and a number of other things. So it really takes a lot coming together to make this happen. And then we're always trying to pull in federal and state funding, since that's our primary way of funding regional efforts on support services here. But also the county, the 7 cities, and private donors are also pulling in funding to try to lift up some of the key resources we have in the region. So with that, how did we start working on these efforts? I think a lot of our homeless support services have been in place for many, many years, but about a decade ago, the region came together to develop its first 10-year plan to end homelessness. So it's a federally required plan in order to get different funding into our region. But the plan was a lot more than just a way to get funds. It was also a way to create cohesion across our agencies. And so at that time, the local agencies throughout the region adopted a plan that basically looked at these 4 main goals. It was focused on creating a regional administrative and financial structure so that the plan could be implemented, facilitating access to affordable housing. That's one of the key ways to address homelessness. Trying to work on prevention and early intervention efforts. So trying to help someone before they become homeless or very rapidly after. And then finally, many years ago, there wasn't quite as much integration across the many agencies involved. So a big effort that a lot of partners were involved with is integrating, how do we better coordinate across all the government and nonprofits and others to make a bigger impact together. So those were a lot of the overarching goals 10 years ago. One of the big efforts since that time, like I said, was creating a more coordinated approach. And so this is something one of the panelists will be able to speak to if questions come up. But essentially, one really big win for the region was creation of a coordinated entry system. So we have 3 organizations in our area, ECHO, 5 Cities Homeless Coalition, and CAPSLO, who each are basically have one part of our county under their charge, and they're helping to channel clients and unhoused residents towards the services they need and towards possible housing. There's a lot of ways in which someone who's homeless or at risk of becoming homeless might come into this system, whether it's through a hospital or United Way and their 211 app, or even just through working with government agencies or outreach workers. There's a lot of ways someone might get funneled in, but then they're put in the hands of our really capable 3 coordinated entry providers who are able to stay in touch with each other and make sure that clients are then as quickly as possible connected to the support services they truly need or the housing infrastructure that they really need. So it's just a more systematic way of trying to help local residents who are homeless or could become homeless. And then there's been quite a bit of other efforts. So that's just one, I think, key area, because a big focus this year is to continue building on that good collaborative nature. But there's so many other things that have happened since 2009. And a big reason why I want to touch on it is I think it's important to not only recognize where we're going, but recognize how far we've come already and a lot of the foundational efforts that exist today, which are going to make us so successful in the future. So some of the things that really stuck out to me as I've been working with the county and organizations is, like I said, there's been more integration across agencies with that coordinated entry system, a regional database where we can share client information to help really get that person access to the support they need. But also local cities and county and nonprofit developers have been focused on creating more housing stock, but particularly affordable housing or stable housing stock. And the purpose there is to try to create that long-term permanent solution. So how to get someone out of being homeless and into a sheltered environment where they're safe. So there's been a lot of progress there, but of course more to be done. Another big effort that stuck out to me is a pilot program that the County Transitions Mental Health Association, Housing Authority of SLO, and Salvation Army worked on, which was a pilot program to basically create housing. It was called 50 Now, and it creates housing for 50 of the most vulnerable chronically homeless individuals. So back on that slide I showed with the subpopulations, the big downtick in our point in time count was when that pilot came on board. It really created these permanent supportive beds where a person could be in housing and then start to be put into supportive services and really get the help they need. That program's proved to be so effective that it's continued on for many years since 2014 and has even increased in size and hopefully would continue to do so. Another great example I think you'll hear more about with our panel. Last year, Housing Authority of SLO, People Self-Help Housing, and ECHO partnered to create our region's first ever Project Home Key, which essentially converted a motel into an additional North County shelter space, as well as an affordable housing units for families. And beyond that, our region has been doing other pilots and trying to ramp up additional shelter and housing space to continue really making progress with our region. And as I mentioned before, I think what really continues to stand out to me is that if we can continue coordinating across agencies and be thoughtful and strategic about our actions, we can continue to make an impact in reducing homelessness over time and helping people when they're in some of their hardest times in their life. So where are we headed now? This is just a precursor, and then hopefully we'll get to come back together with this group to talk about specifics as it moves along. But on May 4th, the County Board of Supervisors adopted a regional framework for moving forward that essentially looks to work across all the local 7 cities, the county, and with our nonprofit providers, as well as our Homeless Services Coordinating or Oversight Council, to lift up several regional initiatives. So I think the focus here is twofold. There's a focus first on near-term actions that we can take to start addressing homelessness, and then also secondly, the rapid planning. So how can we as a region start to look at what longer-term strategies we can all work on together to make the biggest impact sooner. And as I listen to leaders, I think this coming year's focus will continue to be on how do we balance both compassionate service to our unhoused residents, as well as creating a sense of, or maintaining a sense of order and community throughout the larger region. And so I think that that's where we're generally headed. And then along those lines, like I said, the action side of this is so important. So we'll be launching 2, if not more, pilot programs that are focused on tried and true methods that are working as far as just a near-term way of helping people where they're at. So we have safe parking programs that are intended to help our vehicle-based unhoused residents and providing somewhere safe and hygienic that they can go. And then also doing a blue bag program, which is really focused on working with residents that are living in an unsanctioned camp, down by a creek or somewhere else, helping them to clean up that space and make it safe again, while also working to outreach with those individuals and connect them to service and housing, so that truly we can move them towards the longer term goal, which is to be housed and stable and safe. And then beyond those actions, then the region will focus on updating its 10-year plan, which I touched on before. So this is, again, just making sure that our region can come together, select the same mission, and then commit to what each of our agencies' roles are going to be. And I think within that is inherent. All of you on this call who are residents, myself included, will be part of that. We're really signing up to what can our community do to contribute to making this better and to further addressing homelessness in our region. And finally, I think one area that we all want to focus on that's attached to every effort we'll do this year is really improving the engagement and communication across the region. So we'll be looking at creating that a better regional communication about what resources do we have in place today that someone can access or that a community should know about. Where are we headed this year? So as the strategic plan gets developed, where is that taking us? What are the next major goals we're headed towards? And how do we get there? So how do communities engage, and how do we make those strategies into a reality? Whether that's building housing, connecting someone to mental health support or otherwise. And all that to say, I don't mean to say that that's all that's happening. As I think you'll hear about with our panelists, that's in addition to the many, many really important individual organizations, service and housing efforts that are underway. So there's quite a bit already happening through CARES Act funding and ongoing long-term regional programs that are making a huge difference. So this is just in addition to that, making sure we're really bringing our partners together in a focused way. So here I just had some people, this isn't even everyone, but I think I want to reiterate, how important it is for all of us to come together, knowing how complex the issue of homelessness is and how nuanced every situation is that might lead someone into being unhoused. And so we really look forward to working with all the residents throughout the region and the many agencies to come together and work on solutions over the coming year and really over the coming 10 years within our next plan. So with that, I'm going to hand it over to our very capable moderator, Supervisor Ortiz-Lague, and our three panelists, and just thank you all for your time and attention today.
Okay, thank you, Carolyn. Yeah, we had to hire an engineer to help us figure this out. That's all I can say, is that it's very heavy lifting involved in trying to coordinate all of those symbols that you saw on that page. And I think it's remarkable that in the short time she's been here, we're actually starting to see some movement. So I'm really happy that we have Carolyn with us. Good afternoon, everyone. I'm Dawn, and I'm really happy to be moderating on this, very important panel. I want to thank the League of Women Voters for giving us the opportunity to have conversations like this. This is just critical for our community. You have all been so engaged in doing it through this process, and, bravo for really stepping up and being the leaders that you are. I'm going to start with a couple of questions to all of them, Susan, Jana, and Devin, which they all play a really important role. And I'll start with Jana, because Jana's on the ground, more importantly than anyone, I think, that really can speak to some of the things that are going on. So right now, Jana, what do you see as the success, the policies that we have in place right now, where you can actually see some success?
Well, I think, there's a lot of discussion currently going on about new ideas, new programs and things. And I appreciate the question, because we have actually been hard at work for several years doing some things. And I really want to draw the attention back to 2013's point in time count, when we had just some enormous numbers. We were over 2,000. And at that point, the Veterans Administration helped us identify the fact that we had over 250 unsheltered veterans in our community. Since then, hundreds of veterans have been housed through our supportive services for veteran family programs here in the county. Community Action Partnership in San Luis Obispo, and then 5 cities in partnership with Good Samaritan Shelter. We're all working in hand with the VSO and a number of other collaborative partners, the Housing Authority, and federal social workers, to house veterans. And I wanted to point this out because they literally targeted this population. They said, we're going to give you a lot of money to address this problem. And it's worked. It's housing, it's social services, it's healthcare, it's temporary financial assistance, and it's a system change. We as the county had to come together through HSOC to figure out how to build different systems to address this population. And for me, that's a perfect example of if we focus on it and we focus on a specific population, we can make change. There've been a number of other programs. TEMA has a supportive housing program that has been kind of the mainstay for many of our clients for many, many years. Certainly you've heard about, and we'll hear more about what's now the 70 Now program, started out as 50 Now. But I think it's important to recognize that through HSOC and really looking at this systemically differently, we have had some tremendous successes that should not go unrecognized.
I appreciate that. I think it's really great, because you can see when the resources are put and directed in the right way, and the people are ready to go, off you go, and you're able to really change people's lives. And that's just says so much. With that, because, and I'm going to transition now to you, Devin, and that is that, we know that this is the Central Coast. I don't have to explain it much further, that it takes a lot of money to live here, and that we don't have enough houses and all of that kind of stuff. So, Devin, can you speak to the location issue in regards to what it means when we do have the opportunities. We have a lot of, and I want you to speak to this piece a little bit later, the funds coming in, but that means that we have to find locations, and that means that it could be in your neighborhood. Can you speak to that at all, please? Oh, you're on mute.
Thank you. Sorry about that. Yeah, I understand this is a difficult one. It's interesting in my own household with my wife and I, we're a bit opposed on this as well too, and so I get it. I understand the feelings that people have, the worries, and I was, somewhat involved with a project that we all thought was just going to be wonderful, and it didn't come to fruition because of the location issue. And I know at one point in one of the hearings, I mentioned NIMBY, or Not in My Backyard, and I almost got booed out. But I don't know how else to address that, but it's at some point we have to find locations that are within our community. We need to remember that these individuals are part of our community. One of the things I hear frequently, and I'll mention a very interesting story here in a minute, but people will say, "Oh no, these people are coming from other states, other counties. They hear about our services and they give them bus tickets and send them here." So the interesting story was, I happened to be on a flight not too long ago, and I was sitting next to a gentleman from Hawaii, and he said, "Oh yeah, everyone sends their homeless to us." And I was like, interesting. Does he really believe that, governments have that much money to buy plane tickets to Hawaii for their homeless and send them? And, maybe I missed those flights, but I sure haven't seen any homeless getting on airplanes. But so there's this perception out there. And I think a big key to this is we have to educate. We have to understand that, yeah, some of the individuals that we work with in the homeless community might have some difficulties that, we need to be sensitive to. But on the whole, these individuals, at least the ones I've worked with, they're sincere, they're kind, they truly want to do what's best, and they're trying to figure out that way. And for some of them, homelessness is what they're considering their answer right now, but it's not what they absolutely want. And if we move them out into a place where there's nobody, well, along with that, then there's no services and there's no bus system. And so we're kind of exiling them. And what we are trying to do is find areas where we can work with them, where they can get to their services, where they can become self-sufficient, where they can work on improving through our help. And I think that's probably one of the biggest things we need to do, is educate and help people understand these individuals. And I think later we'll talk about some, opportunities available. And I would suggest one is, start volunteering, get out there. There's a lot of community-based organizations that work with the homeless, and they get to know these individuals and can work well with them. I think if we could take on that role of, if you're seeing someone in need and you can help them out in a way, and actually just talk to them and look them in the eyes and be kind, you'll be amazed. Most of the time their responses are very genuine, very kind, very nice.
Thank you. Susan? And anybody who wants to weigh in when we have these conversation too, on any of these questions, you each can weigh in. Susan, I think this leads to you in the sense of, Carolyn talked about, and we've talked about, and thank you so much for leading the, oh, can you see me? Because all of a sudden I don't know why my screen keeps going down. Anyway, we talk about compassion and order. And I know that you, as the head of HSOC, you have the pressures of trying to be a member of your city council, but also representing those partners on HSOC that are really trying to achieve things. And so for you, the combination of what success looks like, location, and trying to execute the responsibilities of both HSOC leadership and city council, what can you say about all those things? I mean, you're right at the front line too.
Right. Well, one of the things that I hear in community after community is that people want their public spaces back. And if we're going to be able to have a way to manage the sharing of public spaces, the parks that people go to because it's a nice place to hang out on a hot afternoon, whether you're running around with your kids and your dog or whether you have no place else to live. We're drawn to those beautiful public spaces for the same reasons. And if we're going to manage how those spaces are shared so that we can all use them and not just have them be a province of those who have nowhere else to go, then we need to have more places where people can go. I'm constantly reminding people, if you don't like where people are, we have to find some other place that they can go. And it's got to be as Devin was pointing out, the urge to let's just sort of sweep everybody out and exile them to somewhere else and put a fence around it and call it good. This doesn't work. These are human beings. They have rights in our society to occupy space. And if we're going to be successful, we have to have more frontline resources in every community where people can, places that people can get housing and shelter so that they're not dependent on living in Mitchell Park or Atascadero Sunken Gardens or the Bob Jones Trail or whatever space it is that we're wanting to be able to share. So what I remind people as we're working on this, that the real payoff for communities in making more frontline resources available is that it gives us a way to better manage the sharing of public spaces. And people want them back.
Yeah. Yes, I think we hear that at every turn. And then there's the piece where they feel like we're not doing enough. And I know that, that's the case in being in a government role now that I see in every issue, that there's the sense where, we're not cleaning the roads enough, we're not building enough of this, and we're not doing enough of that. But Jana, I'm going to hand this over to you now, because I understand that this concept that we're trying to do here with our moderation is that I'm going to give you the question and then you're going to kind of talk to the other panel members, which I guess I didn't quite catch that. But I'm going to turn to the housing first approach, serving people experiencing homelessness. Do you think that the region's current 10-year plan on how to approach to action is moving to a housing first mode? And if that's successful, and what do you think about that? I mean, you kind of mentioned it, and when you had that zero in focus with the vets. So now here we are getting ready to do another 10-year approach. What's your thoughts on that? And then take it from there.
Well, I think the first thing is people need to understand what housing first is. So the whole intent of housing first is that is the priority, getting people housed and keeping them stably housed. So our priority may be to help them deal with any number of other issues, but it starts with housing. And once we have someone housed, then we can continue to work on other issues. But the true point is to not get blinded by any number of things we all face challenges. We all have many challenges, So our first challenge in Housing First is to focus on getting stably housed. And the issue around health, the issue around longevity, the issue of all the social complexities, the burden to the community, everything becomes less when someone is housed. So with that approach, it starts with housing. We have adopted a housing first approach here in the county. It's in fact federally mandated for most of the funding that we're receiving. But beyond that, we are really trying to create housing. And I want to give a shout out to People Self-Help Housing, the Housing Authority of San Luis Obispo, all of the developers that are actually working at creating housing within the strata of all the places, the folks, whether it's workforce housing or supportive housing. We need that. That is where it all begins. And we have to create a vehicle by which people have the income to sustain that housing. I've kind of gone off script, so I'll let Susan chime in. But fundamentally, people need to understand we need housing and we need the income to help people stay in their housing, whether that's through public benefits, whether that's job creation, livable wage. Those two things are paramount before we talk about it. Everything else that we're talking about are addressing symptomatic issues, but we will not lessen our community pain without those two things in place.
Yeah, I think Jan is right on with that. That our county and our region is at high risk of homelessness because housing prices are high and wages aren't. We have a lot of people who are income constrained, who put large percentages of their income into housing. And so when a relationship crashes or a job falls apart or somebody gets hurt, any number of life crises, people end up in losing their housing. And that we have that going on. Plus we have our share of mental health issues and addiction issues. There's a lot of fentanyl out there right now that's creating more dangers. And so people in the public see more homeless people around and they feel like we're not doing anything and nothing is happening. But a large amount has been done. We have developed a good infrastructure for it. We've developed capable organizations. We're just watching the growth in ECHO from over the last several years, from a collaborative of which church was going to have them in their basement this month, sharing, to a sheltered space that could give 24/7 services, that is expanding, that is doing job training, that has picked up a shelter that now has 2 shelter locations, and and a much more a professional level board that's getting strategic level grants and resources. So we're building up resources to deal with this problem. If we just have to in the 0 to 10 year approach in the planning is to deal with that imbalance of housing stock and incomes, and getting to that in a large variety of ways.
And I can add in as well too on this one. In my child welfare background, this was an exercise we would run, and I think it fits well in this situation. I'm not sure everyone who's listening to this, what your lives are like, but I know if you were to add 3 or 4 things that I had to do weekly to my current schedule, it would be rough. It would be difficult to fit everything in, probably cause a lot of stress. Now add into that you aren't sure where you're going to be sleeping every night. That in and of itself is going to be one of your huge overlying stressors every single day. In order to help individuals to get back on their feet and to start, helping themselves if they are capable of doing that, we have to have housing for them. We, back in 2014, I think a great example of this is, we started our our 50 Now program. It's now up to 70 now. And that is working with Transitions Mental Health and providing housing for individuals. And they have, a case manager that's there to assist them and work with them. And its focused is on it started with the 50 most chronic user of services, I guess is the best way to put it. We're up to the 70 now. And what we've found, so the data has shown that the number of ER visits and hospitalizations have been cut down to about half as many now. And for those persons, and then cut back on arrests and days in jail by over 95%. So you can see a program that, may cost a bit to run, actually saves a lot of money in terms of hospitalizations and doctors and nurses and their time being, taken up, and time in jail, police officers busy, dealing with a homeless individual rather than dealing with other concerns in the community. And so a great program that we have running right now that focuses on getting them housing. And then again, once they can stabilize in housing, then that worry is off their back, and they can start utilizing those services that are there to help them be successful.
Thank you. I think that, we've kind of established that we actually have the formulas to try to help people find housing and getting to the next step, getting them into that point of wanting the housing, or how do I phrase it, that they're ready to be working with the system. I think maybe, and that's probably been addressed in other league moments, but I want Janet to talk about that a little bit, or Susan. But before that, I want to ask Devin about the state budget, because here we have one-time opportunity to do some really amazing things, both from the state, and then we've also at the county, we've designated, I think it was 9 million to do things on housing and homeless from our ARPA funds, from the American Recovery Act funds last week. We haven't decided on how. Since it's only one time, I find that what happens is that people are like, oh, well, we don't know how we can do that because it's only one time. So how do you see that playing out? And I'll let you take it from there with the rest of the panelists.
Sure. And thank you for that introduction of the one-time funding. That's a critical piece here. It's something I consistently hear as I work with the various members of HSOC that, one-time funding is great, but the problem is, how do you sustain something, long-term? If, say, we were to purchase several hotels like they did in Paso Robles and convert that over to a shelter, serves a great purpose. You can use those one-time funds, purchase that, make the updates needed, but then, 2, 3, 4, 10 years down the road, where's that money coming to keep that running, to pay the staff, to keep the facility in good repair? So the one-time monies, again, we're grateful for them, but we also want to make sure that as we utilize these, we're doing the best we can and not placing an undue burden on some of the many organizations that are trying to keep things running for long term. And so I'll let the other panelists jump in if they have more on that.
Sure. I think one of the challenges that we face in that balance between one-time money and sustainable money is that the savings that come from properly addressing homelessness are not necessarily aligned with the people who are spending the money to continue to support folks. So if you have a lot of savings in whether it's fire departments not having to make so many emergency calls, or emergency departments in hospitals and in hospital care not having to support so many folks, or people that might not maybe can be kept healthier and don't need a Medicaid bed in a nursing home. There are savings of throughout the system that occur, but there's no way to capture that immediately to have that fund the services that make those things possible. So we're all looking for how we can sustain these efforts. Meantime, there are opportunities to do really transformational investments with one-time monies that can move us forward into things like tiny home villages that maybe don't take as much, that can be relatively self-sustaining with modest levels of ongoing case support, case management, and trash and waste services and things. So, and some of the programs that the county's doing in trying out in safe parking and blue bag programs also, to try to get more first line resources throughout the county, and then at the same time create more next step opportunities for where people can go once they are, coming out of the creek bed, and getting them, housed in a stable basis with some support so that they can gradually function more into the community. And Dawn, you're muted.
There
right
you
now.
go. Here I am. I've had two things going on. One, my monitor somehow just won't work, so I'm working off my laptop. But thank you for your answers. Jana, do you have anything you want to add here? Because I'm seeing some questions coming in, and I want to make sure that we get, we talk about, we talk about this situation. And I think one of the things that's going to be really critical is one of the pieces that Carolyn mentioned was our communication strategies. But if you look at the questions that we're receiving online here in regards to how to deal with the unhoused that are not willing to work with, I don't know all the answers. I know Los Osos feels very much unsupported at this time. They've made that very clear that they would like us to do more. And then we've got other issues along that line as far as why aren't you doing the tiny houses? Why aren't you doing this? And I want you to jump in here, please.
Okay, let me jump in on a couple of different levels, and I'm going to ask people to bear with me for just a second. So we've been talking about all that we've been doing, and clearly there's increasing stress in the community. And that's because the problem is getting worse despite what we're doing. And so I want to talk about the tipping point very briefly, which is when you have more than a third of your income being spent on housing and life support, you are at risk of homelessness. And in a community where you have more than 32% of your people at risk, you have an exponential increase in the frequency of homelessness. So we are in San Luis Obispo County at 38%. So we are exponentially increasing the risk of homelessness and the actuality of homelessness within our community. So yes, we're working, and yes, it's getting worse for that very reason, for the income to housing disparity. The other thing I want to note is, as Carolyn mentioned, people are not one-dimensional. So there is no one-dimensional answer to this. There is a spectrum of services that are needed, from housing to what are you going to do today, because that housing isn't going to come tomorrow. So whether it's tiny homes, whether it's sanctioned camps, the spectrum of services starts with housing, because that's ultimately what we want people to do. But we have to be prepared and respond proactively along the continuum of services that are needed. And that, I think, is something that we're challenged by, because there's such a lack of that. As we are increasing our homeless count and pressures, where do we start? What do we start with? And how do we affect that? Which is, some of the discussion that's going on now with regard to these pilot programs. I'm in agreement. There's a spectrum of services needed across the board. The sustainability is huge. As a service provider, the last thing I want to do is start a program today and cut it off tomorrow. We did that last spring during the onset of the pandemic. We started a program. It was very successful. We shut it down in 2 months. And so that's the challenge that we have. And the planning process that we're going through, I think is very good in terms of trying to really look at the resources we have, but we also need to advocate for more. Back to the state issue, the state is beginning to step up, but it needs to be long-term and sustainable. What I will say, just to conclude, is when you have a crisis, such as a pandemic, you focus, you make action, and you make it happen. If you look at what happened with COVID and the spectrum of ways in which we as a community had to respond, the money that had to come out, the various new programs, everything, people coming together to address that challenge was huge, from the federal level down to the local level. If we were to take the same approach and say homelessness is a crisis and we need to respond in the same systemic way, making ourselves a little less comfortable and coming up with answers and solutions and funding that we did not allocate before, I'm going to go back to the SSVF program. We will be successful, but it has to be across the board, and it has to be a spectrum of services, and it has to be a systemic change.
Thank you. That's powerful. Susan, do you have anything? A couple of things that are coming across on the chat and the questions. There's the question of, oh, yes. I think one of the things, and I'm going to let you start with this, Susan, is that, why can't you just let people have land use issues addressed quickly? And, as a community, I think we all know that everybody wants their neighborhoods to be a certain way. And yet, they wonder why we in government haven't been able to utilize open spaces or do other things to make opportunities for whether it's campers or whether it's the tiny homes or whatever. Do you want to try and address that, Susan?
Well, where I want to go with that is to talk about the importance of building trust. If you want to get people out of homelessness, it takes a sustained relationship with that person to help to get to where they can trust that you can help them, and that the safety, you're working with people who are defining themselves by their capacity to survive on their own, and to say, we can, to offer you something that ultimately will be better, but it takes time to build trust. The same way we have to build trust with our communities. So, for example, in Atascadero, we had a local church that stepped up to host the Winter Warming Center here for COVID, knowing that it needed to be 7 days a week and run for the duration of the colder winter season. And a brave pastor, and worked with not-for-profits that the smaller not-for-profit that transitional food and shelter that had gotten the grant for this and had run a smaller shelter for a few years, passed that to ECHO, which was better situated with a broader volunteer base and a bigger staff to handle it. And the church is located in a community, in a neighborhood, near the police station, but in a residential neighborhood. And the residents were absolutely up in arms with fears about what this meant for their neighborhood and the community, with who would be there beforehand, who was hanging out, in their neighborhood afterwards, after the center let out. And there's a lot of concern. And those concerns, you have to take those concerns seriously. It also was a situation where the church did not have to ask anyone's permission to do the mission of a church in that space. They were there long before Atascadero was incorporated. So they stood up and said, this is what we're going to do. They listened to their community. They worked with ECHO to communicate. They developed serious plans to address those concerns, how people would be screened, how they would come to the shelter, how they would leave the shelter, what kind of supports would be provided, the role of the congregation in making sure that the community stayed safe through this. even down to managing, where on the property was the smoking bench going to be located and when would it be utilized, so that you could deal with who was downwind of that. And all of those concerns, are important to take seriously, but it also is important for us not to have those concerns stop us in our tracks, or we're never going to be able to find ways to help folks. So in the course of addressing those concerns, by the end of the winter, some of the residents who had been most vocal in concerns early on were bringing cookies by the end, or mentoring people who were working to get their families out of homelessness. Some of them, it wasn't a panacea, but a lot of progress was made. And we have to do that with our communities, to take their concerns seriously, but also not let them be the barrier that keeps us from better managing the way homeless people are in our public spaces.
Well, and you started out talking about trust, and the end of that story is that those who came and used that place at night, what was the result after 4 months of being together?
They got over 18 people into the Echo Atascadero transitional shelter. And as of a few weeks ago, last I checked, they had already gotten 8 of them into permanent housing. Many of these people had been on the streets for a long period of time. They were local to our community, and that toughest population to work with. So this is a huge victory, and much of that was because people were in in relationship and supportive community for a long enough period of time that folks could start to see a pathway of hope for themselves.
Yeah, thank you. Yeah, and I think that's kind of what you were referring to, Jana, in talking about the immediate ability to be able to get them to transition to the next steps of finding a way for sustainable life, even with the numbers that you gave, about 38% at risk in regards to being homeless. There's about 4 questions out there right now in regards to, we'll talk about those, but then there's this piece that exists, and that has to do with the mental health situation. And, we can have services, we can offer services, we can have, even situations where we do pilot programs, and perhaps we are going to get one of those tiny house pilots. But when it comes to the mental health crisis in this country, I think that we've got some areas that are just not fully addressed and well known. So professionals out there, Jana or Devin, Jana, why don't you start? Do you want to make note of any of that? The questions are, how many are mentally ill? What do we have in order to, get them to get help? And recognizing that we really don't have laws to make people take their meds or get help. So
I'm going to punt to Devin first. I'll be happy to weigh in, but I'm going to point to Devin.
Thank you.
And I believe it looks like Carolyn's actually typing the answer right there. And first I want to, and I notice we have, addictions, mental health, commitment laws are all kind of the 3 last questions so far. It's important to remember, any group of people, it was mentioned in my bio, I'm a licensed marriage and family therapist. I had to put practicing on hold for a while. I just don't have the time with my current position. But even dealing with individuals who are in, good health and not drug addicted or anything, maybe they're having problems with their significant other. People have to want to change. They can be as healthy or as on point, normal, if we want to use that term. And if they choose not to change, they're just not going to change. And so in terms of we have these services available. We can help individuals who want that help. But there's nobody who can be forced to change. That's one thing we always keep with us. We have that ability to choose for ourselves. And so in working with the homeless, it's the same way. And I really appreciate Susan's comments on gaining that trust. And it's both, you know, trust with the homeless and it's trust with the community. I see a lot of, you know, frustration in here on some of the comments. And again, I totally understand that. But this problem is not going to be solved overnight. It is going to be a bit of a long-term process, and you know, continuing through on it, and every little success. You know, Susan mentioned the 18 people that were helped out and into the Echo Shelter there. That's a success. But we walk down the street or drive up and down the coast, we're going to see 20, 30, 50 homeless individuals, depending on where we're driving. And 18 doesn't seem like much, but every little improvement we make is helpful. And so in terms of the commitment laws, I can tell you those are very stringent. In my field with Department of Social Services and helping the elderly through Adult Protective Services, this is one of the areas judges do not take this lightly. If we are going to look at taking someone's right to make their decisions away, that is a very difficult push. I mean, it has to be so absolute that they'll go with it. And so that's working with people where we know where they are. It's difficult then if you have individuals who you're not sure where they're going to be the next day, and working with them. And we have to be very careful on that, you know, institutionalizing adults. You know, we look back in our history and we had a real problem with that. And so I caution us. I think we need to be careful as we move forward in those realms, do what we can if it's really in the best interest of an adult, or just continue to build that trust to where they'll be willing to accept services and hopefully improve.
Go ahead, Jenna.
So, you know, I want to follow up just briefly. Change doesn't happen overnight. It also isn't an absolute yes or no. And I want to segue a little bit to my hope for our new medically assisted treatment facility that's under construction at 40 Prado. So in my neck of the woods, we don't have a shelter. We see people come and go out of our office. We reached them out in the camps when we're doing outreach. One example of a woman who we have helped, she was a professional in the community, had a catastrophic event in terms of relationship and marriage, fell into addiction and abuse, spiraled into homelessness, was on the streets for many years. She was one of our frequent flyers. She had had hundreds of arrests. We worked with her in and out sporadically for years. We would lose her, she'd come back. We'd lose her, she'd come back. Usually she was under the influence when we were dealing with her. Eventually, one of the times that she was in the jail and she had been there long enough to stabilize, we were able to go in and work with her, and we took her directly from the jail into housing. She's now one of the 70 now clients. She has been stably housed now for 2 years and is completely transformed person. Addiction is real, mental illness is real for lots of things. People fall into homelessness for all sorts of critical events, but there usually is some critical event that happens. In this individual's case, we didn't have the treatment model that worked for her. And I don't know that the new medical treatment facility is going to be the panacea for everybody, but it is certainly a tool that we have not had in the county And this is something new coming on that I'm very excited about. It's near and dear to my heart. But this woman is an example of where change can happen, but it took a long time. It took a lot of bridges. It took a lot of trust. It took resources, and it took a different approach. Literally, the jail called us and said, she's being released on Saturday. We need you to come in on Saturday and help get her housed. And so we did. But you have to look at it differently, and we have to be able to accept a different timeline, because everybody works on a different timeline. And again, change is not absolute, and it isn't certainly necessarily going to happen in one day.
I think that's a great story to kind of round out this conversation. Glenn or Ann, I want to ask on our time, and if there's any other, I think, Susan, you're in charge of the 10-year plan. We've decided to call it, not the end all for homelessness, but do you want to touch on that briefly? And then we'll just kind of round up with some closing comments.
Sure. We are in this process of building a 0 to 10-year plan to address homelessness. I have promised the county supervisors we won't be ending homelessness for all the reasons that Jana has articulated well there, of us being so terribly at risk of the. But what we can do with this process and must do is to make episodes of homelessness less common, shorter, and less traumatic to the individual, to the environment, and to the community. Because homelessness is a trauma on all 3 levels, no question. What we're doing in the planning process is working with a small core group that's going to be communicating regularly with lots of different constituencies, with the mayors and the city managers, with law enforcement officials, with everyone who's involved already with the Homeless Services Oversight Council. And also doing focus groups so that we're talking with people who have lived experience, people who are advocates in a variety of ways out in the community, business people, and mental health professionals, the hospitals and healthcare community, all kinds of different folks who have different slices of perspective on this very complex situation that is how people get into and out of homelessness and how we can address that. So I would encourage everyone, this is going to ask a lot of each of our communities in order for us to be effective. Jana laid it out there that we can do big things if we go after it in a big way. But it's something that people can do to help support this process in their own community of what their community is doing, and resisting the urge to feel like we should just shove this to somebody else's community to address, because we all have our share of people with mental illness and with addictions. We all have our share of people who are, working and can't afford housing. So volunteer to shelter, or contribute to a meal program. Do something. When I chaperoned at the warming center, I discovered that there were 2 people who came from their permanent jobs while they were there, but couldn't afford housing at that moment, and others who were dealing with a variety of physical health problems. And the most destructive activity that happened during the night was snoring. So you can get to know in a personal way by stepping up in whatever way you can so that we can build the base of support we need to take action.
Yeah. Thank you. Thank you. Devin, I'm going to let you go next. And someone had written in about realignment and monies that come from the propositions and regarding, all of the retraining and all of that that's going on. And as you close out your comments, can you just address some of that we have a lot of people re-entering our communities that have been incarcerated. And I know we do have a lot of programs, so I'll let you go from there.
Yeah, and I was just reading that as well as I was listening to Susan's comments. And those monies wouldn't be coming through social services. So in terms of I've heard about the programs and stuff. I'm not sure of the success rates on those. And so I don't know if anyone else knows I'm not sure of the success rates on each of those. I appreciate what Susan mentioned on the 10-year plan, and I just really want to emphasize we were required to call that the 10-year plan to end homelessness. When I heard that title, I just kind of shuddered, because that's 10 years, you're not going to end homelessness unless everything just falls right into place and you have tremendous support all the way around. One of the comments in here I mentioned about it takes everybody to work on this. Government isn't going to end this problem. It takes the community, it takes community-based organizations, it takes the government, it takes all of us working on it together. And that's kind of how I see this 10-year plan. It's an opportunity for anybody who really wants to get involved to be involved in this and look at ways and ideas. I mentioned in one of my responses that to one of the questions is that one program won't work for every single person. And I think Jana touched on this as well too in her comments, that it's going to take multiple things that will meet the needs of individuals. Some may need one thing, some may need another, some may just need some time. And so the 10-year plan is a way that all of us can focus on, so in the next 10 years, what are the critical things with the money that we have coming in? Where do we need to focus that? With the cost of housing, what can we do in focusing our efforts there? What are the needs throughout our entire county, not just certain cities or sectors or anything? How can we look at this in the big picture? And the more ideas that we have and the more involvement, the better. So I do encourage anyone who's interested in getting involved in that way to reach out and be involved in some of these groups that will be forming to get input and feedback.
Thank you. I'm going to make a suggestion now because we're getting to the end. I want to let Jana close this out, and then I would ask the league if we could get some of those questions. I think that we need to respond to some of them, including a list of where people can volunteer. All of these are really good questions, and I'm, again, big conversation, big subject, many facets. One of the things Carolyn mentioned was our communication strategies that we're going to be working on, because we certainly could be communicating a lot more on this. But on that note, Jana, do you want to close out with some of your thoughts and hopes and dreams, please?
Hopes and dreams, those are the big ones. This is the last of the series that the league has put on this subject, and it, I think, exemplifies exactly everything that we have been talking about. It's a very complex issue. People are complex. Causes of homelessness are complex. The solutions are complex. Otherwise, we would have solved it all already. And it starts with a gaining and understanding, and then it starts with engagement. And if I have one message about hopes and dreams, it's that those that are listening today don't feel as though this is someone else's problem, or that what somebody else on this call or the government has to solve this. We as a community need to come together on this, and we each have a role that we can play. But it starts with understanding, and then it starts with helping to come to terms with what that action plan is. So this 10-year plan that we've been talking about, let's make it a 1-year plan and go from there. But let's all decide that we're going to do something. But let's do it together, because it's going to take some systemic change. So I sincerely hope that that this has been helpful. And more importantly, I think we need to keep this conversation going. I applaud the board of supervisors for making this a priority. Without that, we will not see change. And I really am very appreciative again to the league for really focusing on this issue and for everyone's attention that has attended these last times, because again, it starts with understanding, and then it starts with ideas. And those are my hopes and dreams.
Thank you. Anne, hand it over back to you.
Thank you, Dawn. Thank you all so much. I am just so thrilled with this presentation today. You are all just terrific, and your hard work is definitely evident in this program today. And just as a reminder, this has been recorded and you can watch this one and the 4 previous panel discussions linked to our website, on YouTube, and on our Facebook page. I'd like to especially thank our communications team, especially our Zoom master, Dave Humphreys, Janice Langley, who has been so terrific in doing the publication in the news briefs, alerting the public to these panels, and to Marlis McPherson, and most of all, to Glenn Silloway, who has worked so hard and been so dedicated in making sure that this program comes to fruition and paid so much attention to detail. He's just been fabulous. So thank you so much, and I hope that we have provided enough information for people in the public to join in the efforts in addressing homelessness and to volunteer and help with this critical community issue. Thank you so much.